If it is crushed, the signal going down will not be transmitted well. The lateral quadriceps is very tight. There are people who have tingling in their legs without knowing it. When it comes to everyday pain, how to deal with it wisely in your daily life, I'll let you know. Why is my leg numb? Tingling discomfort. The tingling pain was squeezed by the nerve for the muscle. You can look at it that way. Any other stabbing pain, it's not a tearing pain. If it hurts like that, go to the hospital. You should be hospitalized, not exercising. Go to the hospital, find out the cause, get an accurate diagnosis and get treatment. When you say you have a daily stinging pain, I'll tell you, many people have numbness in their legs, back of a thigh or buttocks. You may feel a tingling sensation in your buttocks and some hamstrings on the back of the thigh and calf toe. Numbing pain all the way to the toes. To massage the numb area, you're not relaxing. That's not going to be cause. The cause is on the hip side. It says piriformis. Piriformis is from the middle of the sacrum to the upper part of the femur on the thigh. The attached bone that the piriformis muscle origin. If the piriformis muscle is elongated and stiff, what happens if our nerves go down from the brain to the tips of our legs? The nerve is being squeezed in the hip area. If you press it now, the signal going down will not be transmitted well. I talk on the phone, but I can't hear you. So you can't hear me. Say it again. Feeling like this. The feeling is like being numb. What about nerves? I have no choice but to move with my muscles. Nerves are attached to the muscles. It is essential mechanism in kinematics. The muscles should not be in a shape that slides well with each other. It's the right move. This is a biomechanical explanation. You have to slide on each other like this. When a nerve presses on a muscle, it cannot transmit a signal. When you exercise, move your muscles. All those movements are nerves. A signal must be transmitted to allow the muscle to move. That's why nerve is totally related to muscles. Release the crushed piriformis first. You must have seen like kind of movement a lot. With one leg as both legs, place it on a small ball or foam roller. You must have seen a lot with weight. You need to do this. But the move is considered a temporary measure. People have more important muscles. You've never heard of this method. I have an external fascia of lateral quadriceps. The vastus lateralis is at the diagonal of the thigh. These are muscles attached to the outside. The lateral muscle is very tight. It's not a disease. Those with back discomfort and numbness in the legs, you should relieve the lateral oblique muscle. You can see what can do. There is some reason for piriformis to get tight. If the piriformis muscle is stretched, the leg rotates inward like this. The lateral quad is getting very tight, so the shape is about to change. Loosening tight muscle is very important. I'll tell you how to relax. This will work really well. Place your thighs on the foam roller. Lie face down with your elbows on the floor. It can be in shape, as if your head goes all the way down. Position your back so that it is parallel to the ground. Turn your body slightly to the side. The outside of our thighs are supposed to touch the foam roller. In this state, roll the foam roller, roll back and forth. But don't roll it short. Go up to the top of your pelvis and go all the way to the bottom of the knee. You have to. These muscles got tight. Tightness can cause pain. Tight muscle need to be relaxed. Muscles should be in a soft state because the soft muscle can cause the right movement. In the case of being extended and becoming a tight, it can cause inflammation in the tendons. Release tight muscles before inflammation occurs so that it doesn't happen. Prevention of inflammation is very important. Exercise doesn't cure disease. Prevention should not be ignored. Prevention is so very important. Then do another sweep back workout. The greatest effect can be expected when used together. Next time, you've even relieved your knees now. Sweep back body type now on the calf side. We have to release the part about the Achilles tendon. Many people have cramps in their legs. Person with the cramps in the calf. There are many people who get convulsions while sleeping. Biomechanically, why muscle cramps occur? Let me tell you about the causes of cramps in the calf muscles. How to solve it? I'll tell you how to exercise.